Hello, assalamu alaikum, everyone. Welcome to our next session of Zooming in on the Halal Metropolis, where we're talking to different members of the Muslim community to see how they're coping amidst the coronavirus and how their projects and their work and their families are being affected by what's going on. So with me now is Dr. Muzammil Ahmed. I just wanted to welcome you to this little segment that we're doing. Just wanted to start off with just asking you, how are you? How are you doing? How's your family doing?
Salam. Thanks for calling and thanks for checking in on me. Alhamdulillah, I'm doing good. My family's doing well. These are new times. We're still getting used to the reality and the expectations of this new era. And, I think it's something that's going to have a long, meaningful impact that we're still just trying to get our heads around. So.
And what are you seeing that's happening in the communities at the mosques and things like that? Are people taking the right steps and trying to make adjustments?
I think there's initially a certain amount of doubt and skepticism about the information out there. I think really in the last 5 years or so, what is truth, what is fact, what is fiction, people have just not been comfortable with solid bits of information. And so when we had scientists and academics saying that this is something that's happening, that skepticism that has probably pervaded all parts of society seeped in, and people didn't take it seriously. And all of a sudden we started to see really dramatic sorts of impacts happening in New York and other parts of the United States, certainly in Italy, certainly in China, and that really started to wake people up. I think it didn't really have an impact here in America until it happened in New York, and it didn't have an impact in the Muslim community until a lot of the Muslim community in Michigan, at least, a lot of us are physicians or in healthcare. We started to raise the alarms. We started to see people getting sick, people in our own community getting sick. And I think in some ways the Muslim community is very quick to start to clamp down. I'm so proud of the Imams Council of Michigan, different community groups in Michigan, very early on say, wait a minute, this is serious. We need to really reconsider what we're going to do for Friday prayers, for our programs. And they really jumped on the bandwagon pretty quickly. Alhamdulillah, as a result of that, we're seeing in Michigan, the epidemic is not as bad.
And so you're also on the front lines. You're at Beaumont, and can you give us a little bit of insight in terms of what's going on in the hospitals, how people are dealing? We keep hearing about equipment and supplies. What are things like at Beaumont where you are?
Yeah, Beaumont Hospital is an 8-hospital system in this area. And we were taking care of about 70 to 80% of all the COVID positive patients in this area.
Oh, wow.
And Southeast Michigan was hit very hard. Initially when we started to realize that this is something very serious, we started to see 100, 200 patients a day being admitted to our hospitals and getting very sick. And we were not ready. The hospital system wasn't ready. I think, again, countrywide, people were not prepared for the onslaught of the COVID-19 virus. So there was shortages of equipment. There was shortages of ventilators. We didn't have the staffing. We at the hospital level, I'm a chief of staff of one of the Beaumont hospitals. We had to do a call of arms. We had to get our docs together and say, I know you're an emergency room doc, or I know you're a family practice doc, or heck, I know you're just a resident or obstetrician. We need help taking care of these patients. Can you volunteer, take some extra shifts? And it's amazing. So many doctors stepped up, nurses stepped up. It was a few weeks ago, it was very, it was really all hands on deck. Everybody pulled together, and it was really great to see. And in Michigan, I think data from the ISPU has shown that about 15% of physicians are of Muslim background. And this was great to see a lot of people have come together from our own community and really put differences aside and rise up to this the COVID-19 challenge.
Yeah, certainly. I've seen a lot of friends and family that are in medicine and healthcare on the front lines, working on this issue and tackling it. And I think it's something that, it's worth really recognizing the amount of Muslims that are involved in helping address this issue. So it's really incredible to hear that that so many are involved in it. Another thing that's kind of on my mind. We ask all of our guests when we do this program is, with Ramadan coming up, it's going to be a very different experience this year. And so what are your thoughts on that? And what would you advise the community to kind of handle that?
Well, I was actually kind of pleased because I'm not going to go to a lot of iftars, and the massive weight gain that I've obtained from not going out and about is going to be hopefully going to be avoided. But on a more serious note, it's tough. It's Ramadan is so much about getting together with family and friends and community, and that's and the Tarawih prayers and the evening gatherings. We look forward to it so much. We are going to have to curtail it in some fashion. I think that at the rate of the spread of the virus currently, it has started to plateau. But unfortunately, if we put down our guard, it may spike again. And so Ramadan, which is going to be in 2 weeks, is going to be a really important test of how well we socially distance ourselves. If we do get too close and start doing things we shouldn't be doing, spreading the virus, we can see a spike again. So, it's going to be very tough. But we need to rethink the priorities in our life, and maybe this is a time to think outside the box, get into a space we're not in before. Get out of our safe spaces, and there will be other Ramadans where we can be together and do the things that we've done for the last many years. This year, I think we're going to have to do things a little different, and sometimes doing things different is a good thing.
Yeah, it certainly helps you appreciate things a lot more as well. One of the things that you mentioned is it looks like the cases are starting to plateau at this point. I'm sure you get this question a lot, but how long do we have to have a sustained level of like maintaining the status the way it is before things can go back? I mean, we're at a time now where it's not just Ramadan, we're in the middle of Passover now, it's Easter weekend. There's so many of these big religious and cultural holidays and gatherings that are coming up that are being totally disrupted by this. And so I'm sure it's a question on a lot of people's mind, but what are your thoughts on the length of time, when we can go back to normal?
That's tough. The governor has set May 1st as a date. And if that might work, the thing is that the virus does spread very easily, and it spreads in a very undetectable way for the first couple of weeks. So if unfortunately, even though the hard cutoff and the safe shelter order, which is going to be in place on May 1st, even though that might maybe over May 1st, if we start congregating too much and we run risk of reinfecting, bringing the virus back into our communities and causing an extended lockdown again. So I think it will be a good month or two before we can really freely congregate and go out and about. The good thing is we did not have rapid testing before. We did not have easy ways to measure the amount of disease that's in our community, but the testing has been more widely available. And I over the next couple of weeks, these rapid tests will allow us to see who is infected, who's not, and we can make more intelligent decisions about coming together. Maybe we're going to have Ramadan where even the men are wearing burqas, and we have to. That actually is a great way to prevent the virus and help you be conscious about touching yourself and shaking hands. And but it'll be a good couple months before we can safely say we can shake hands and hug and do all the things that we love doing and going to Jummah prayer and stuff.
Yeah, I mean, I feel like even when the order's lifted, there's going to be a bit of reluctance, I'm sure, that people are not going to feel super comfortable going to large gatherings or hugging or shaking hands right away either. So That's another thing to keep in mind. And so, we'll see how things goes. We're, inshallah, things keep getting better, and we can all return back to a sense of normalcy. But it seems like in the near future, this is kind of our new normal, at least for the foreseeable future. So, yeah.
I take it as everything has a silver lining, and it's certainly, maybe I tend to be unreasonably optimistic, but it really, I think there are very few things in this world that disrupt everything. And, sometimes a good disruption is a good thing. It really gives you a chance to sit back and think and reassess and learn new things and do new things that, I think all of us are doing and thinking and things that we never, just in totally different ways. So, there are hardships, certainly. A lot of communities, especially the underprivileged communities in some of our neighboring areas, are much harder hit. But there are also opportunities that I hope people do find here, and certainly in the medical field, the kind of innovation that we're seeing so rapidly in the last few weeks as we confront this challenge are just amazing. These new rapid tests, these being jump specialties, it's just been really awesome to see.
Well, on that note, thank you so much for your time. We really appreciate it. Keep up the great work. We really need people like you.
Well, we need people like you. So you keep up the great work. Thank you for everything that you do. And I hope everyone has a safe time through this tough time.
Thank you. Wa alaikum assalam.